I'm Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here, I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medications. This can help you to understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient suffering from hypertension for the last 18 years and on medications for hypertension, diabetes for 9 years, varicose vein for 15 years, peripheral neuropathy, that is as a complication of diabetes and hypertension, benign prostatic hyperplasia and erectile dysfunction, chronic kidney disease stage 2, chronic liver disease stage 2, gallbladder stone, and skin discoloration of mainly of the face, and many other minor symptoms are also there. Here I will try to explain how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in the periodic tests. When we come to the details of the patient and the case study, this is a male patient, height 175 centimeters, weight 86 kg. His age is 60 years, but his body age is 65 years actually. There is an accelerated body age is there of 5 years. And abdominal circumference 100 centimeters, fat percentage 30%. When we come to the diagnosis, hypertension 18 years, diabetes 9 years, varicose vein 15 years, peripheral neuropathy is there, benign prostatic hyperplasia is there, erectile dysfunction, CKD2, CKD means chronic kidney disease stage 2, chronic liver disease stage 2, and a gallbladder stone, and skin discoloration, especially of the face. And when we come to the categories, what is the category of this comes to these diseases? Actually, metabolic, that is diabetes, hypertension, etc. comes under metabolic disorders, and also this varicose vein comes actually under autoimmune disease actually. When we come to the patient's medicines, what is he's taking is actually he's on hypertension medicine Taslog 40 milligram and telmisartan, that is telmisartan 40 milligram, and glenilum, that is glibenclamide and metformin combination, that is twice he is taking. Not much of medicines. Usually, many of my patients is taking 15, 30, that many number of medicines also we have seen. But he is not taking much medicines. But with this medicine itself, his HbA1c is 11.3. His sugar is not at all controlled. RBS is 272. He's having his amylase and lipase is high. That means pancreas is inflamed. That is why this amylase and lipase is the digestive enzyme that is oozing out from the pancreas. That shows the pancreas is edematous and inflamed. And in such patients, the chance of pancreatic cancer is high actually if it is continuing long time. His total cholesterol is 312 and triglyceride is 172. and his GFR is 69, that is kidney function. It is glomerular filtration rate is come down, creatinine is going up, and urea is also going up. Microalbumin level, US protein leak, and microalbumin is 116 in the urine, and sodium is going down also. And that is, we see many of the patients nowadays with the so low sodium that the electrolytes is going down, especially the sodium, maybe because of the type hypertension medicine, and also this because of the uncontrolled diabetes also. Next is liver function. Is on the scanning, there is fatty liver is there, and also gallbladder stone is there, and SGPT blood level, SGPT is 76.8. Autoimmune antibody AIM, that is antimicrobial antibody, is also positive. Usually that is checked in hypothyroidism, that is Hashimoto's thyroiditis. But his thyroid function is normal, but his AIM, that is high, and vitamin D is low. When we come to the symptoms, actually his main discomfort is the burning feet. He's not able to sleep properly, numbness, and the sensation is reduced, and the dryness of skin and itching is there all over the body, but not much skin lesions. There is no skin lesions, but dryness and itching also is there, and irritant cough is there. That is maybe because of this thyroid autoimmune antibodies also is high. And the pain, especially the leg, he's having varicose veins, and maybe because of some peripheral artery disease also is there, and difficulty in urination and frequency, that is because of the BPH, and erectile dysfunction also is there. Then when we come into the body parameters, his weight is height, we have already said, is 175 centimeter, weight 86.2, BMI 21.8, BP, in spite of with medications, BP is 150/100, and abdominal circumference is 100, and body is 65, 5 years acceleration is there, and fat percentage is 30%. 30%. Ideally, the men should have around 10 to 20, 15%, but it is double. 30% is fat in the body. When we start with the clinically supported lifestyle correction, that is basically this food and the body, what is their activity is in a prescribed manner. In the food, what we are trying to bring around 650 to 700 calorie, but with all nutritions in the correct proportion, especially those who need for the weight reduction. It is, if the weight reduction is not needed or there is not excess fat, then there is not that much calorie control is there. But within around 650 calorie, all the nutrient, that is actually human body needs 57 nutrient, including water and oxygen. There is no control for the water and oxygen, but all the other things that we have to actually, we have oxygen intake we had to increase, and also the water to be taken enough so that any excretory, any toxins are there in the body, it has to be gone out. And 14 vitamins, 14 minerals, and all the essential amino acids and fatty acids, that is omega 3 and 6, and the body building other amino acids, and this body building fat like omega 9 also should be. It should be there in an optimal ratio actually. That is what we are ensuring with the special food, and also to see that the food doesn't contain any color, preservatives, that is food additives, which is of non-nutritional value. Usually the food, we are concerned about the food taste means basically. So, and also the processed food will be containing so many additives, coloring agents, preservatives, soothing agents, and so many things will be there. That is all. Actually, the body needs only nutrition. Whatever things other than we are taking, including the medicine, is considered as a toxin for the body. So when even the toxic food, the nutrition is in excess quantity, like your carbohydrate, which is converted into glucose, that is the major problem with the diabetes actually. The major toxin for the diabetic patient is the excess carbohydrate. And also, this patient is a fatty liver, patient is having excess fat, obesity, and fatty liver. So, the excess fat, triglycerides, also is a toxin for him. So, bring down all these things, and also he's having an autoimmune issue also. So in that, what all things which is the regular food items which is not the body is reacting, the immune system is reacting. That is, when the immune system is reacting, food or the cosmetic or whatever you apply on the body, if it is reacting, that is actually we consider as allergy, and that is IgE mediated, and also there are IgG mediated intolerances also we can check. And this patient was having many things which is intolerant for the example milk, egg, wheat, even rice. He's allergic to rice also. So those things are actually creating problem for him. When after starting, we again review on the 8th day, and the 8th day actually he was the first day itself. When we start itself, we stopped the diabetic medicines. That is what Glini he was taking. It is stopped, and by the 6th day, before actually 8th day came up for the review, and he has stopped the BP medicine also for the last 2 days. And because when we monitor the BP, it is come down to normal. So if it's only one medicine, initially it is made into half, reduced to half, and then again the BP was normal, it was reduced and stopped actually by the 6th day itself. When they come for the 8th day, there's no medicine actually. But with the no medicine, after stopping the diabetic medicine, his SbA1c came down to an 8th day itself 10.4, and 15th day it came down to 10.1, then 30th day it is 9.5, and 60th day it's 7.7, and 90th day it is 6.6. Actually, in the initial days, that coming down was slightly low because he was having some function and all. He's taking little bit carbohydrate from the thing. And actually, the patient is allowed to take mainly for this sort of patients, especially a diabetic patient who under introduction. They are put on a more leafy vegetables and non-veg items are, because non-veg items doesn't contain any carbohydrate. Moderate the prescribed special food plus some leafy vegetables and uh, non-veg items is the preferred things. And when the sugar level comes down, if it is a non-vegetarian patients or vegans and all can have pulses also. And that is the pattern actually. And but once in a week they can have a cheat day also, so that any craving is there, they can take the food, and that day we can we give some medicines which is not reduce the absorption and to clear the stomach also. There will be some old food and all will be accumulating in the stomach if it is there also. Once in a way you can take a some whatever things which is of your interest, but it should not be of it is intolerant food, that's all. So there will be whatever, so the patients won't develop craving. And also the diabetic medicines is over, no? So when the medicines are over, your appetite and the craving for food will come down. And when we consider about the other parameters also, especially the GFR was initially low, and it was only 69, and by day 90 it came down, increased to 84. And microalbumin level was urine microalbumin was 115, 116.88, 116, came down to 37.8 by day 90. And liver function test, liver enzymes was high. It was 76.8, came down 56.8, 53.85 on the day 15, and by day 30 it is come down to normal, only 31. And monoclonal antibodies actually, that is AMA was positive, and 132, and it, by day 30 it came down to 57, and by day 60 it came down to normal. Even the autoimmune activity is getting corrected. That is what it shows. And then we have talked about the pancreas. He has high pancreatic enzymes level also, and it has come down from amylase come down was 166 was come down to 80 by day 30. 30 by day 30, the pancreas inflammation also came down. Amylase and lipase come down to normal. So almost all the parameters has come down to normal by 30 days. But some this SbA1c and all, it will take some long time, because it is that damaged blood has to be replaced. So it will take almost 90 to 120 days to replace. That is the lifespan of the blood of a RBC, that is red blood cell. So this hemoglobin is inside the red blood cells, no? So it will take the SbA1c to normalize. Even though blood sugar is normalized, SbA1c will take it is 3 to 4 months to normalize. That is why it is gradually down. By 120 days, most probably you come down to below 6, and by 150 days, it will come down to 5.5. That is what is the 5.5 or below is the desired level for optimizing health actually. Then the symptoms actually, when you come to the symptoms, yes, 50% of all the problems were over by 50 days, and the dryness, cough, skin dryness, cough and pain and all is disappeared by 8th day itself. And difficulty urination around 80% is disappeared. And only that burning of especially that neuropathic symptoms, that is like that. It is come down only gradually. By 30 days, it was almost 80% is over, and 60 days there was on the tip of the great toe there was some numbness was there. By 90 days, all the things were over, symptomatically. Next, when we come into the body parameters, what was the changes which has happened? His weight was 175, and his height 175, and initially weight is 86.2. And on the 8th day, he came down to 82.7, and 15th day 80.3, 30th day 76.3, day 60 71.8, and day 90 68.7. Initially, actually, his weight reduction was very fast, so I asked him to not too much reduction is not needed, and we are aiming around 20% in 3 months. That is enough actually. 20% of body weight reduction is the, and some people, if it is very obese, then 25% also can be allowed. But too much reduction also is because the body the balance and all, because our body weight is also, it is balancing this one also. So around 20 to 25% maximum. Around the 20 percent reduction, if someone is getting, that is, I'm very happy about the result actually. And this person actually from 86.2 to he was able to reduce 68.7. And the BMI also corresponding decrease 28 to 22.4 by 90 days. BP, yes, with medicine, his BP was 150 by 100. It came down to without medicine 130/90 actually. But they actually at when we look at, when he was looking at home, it was only 120/80, 120/70 and all. But when we after travel, he's actually he's coming from North India. That's outside Kerala actually. He's coming by flight every week actually. So after travel, flight and all the transportation and all, his BP was slightly, definitely it will be slightly higher, especially in the hospital setting. It is 130/90 and it is came down to 90, the 30, by 60 days itself, it is at the hospital value itself was come down to 128 and it's maintaining at home. Actually, he is maintaining at 128, 110/70 and all. And abdominal circumference, actually the midriff has come down from 100 to 86 in 90 days. And body age is is 60. Actually, he was plus 65 actually in the initial, and his body age come to down to 57 in the 30 days, 53 in 60 days, and 50 in 90 days. And fat percentage was 30 when starting and came down to 22.5 on the 90th day. So it is not the diabetes or blood sugar or BP alone is you cannot just reduce the BP or diabetes, blood sugar alone. You had to correct your body. When your body is corrected, whatever disease you are having, you will be get relief. And even for the varicose veins, when the abdomen is reduced, the intravenous pressure is reduced, varicose vein will disappear. If it's not, disappear means if it's severe conditions, it may not disappear fully, but the symptoms will be relieved. Now, when we come to summarize the benefits of clinically supported lifestyle correction, the symptoms, actually he becomes symptom free except the mild numbness of the legs by 30 days. Legs means only the tip of the toes, great toe was remaining actually. And then the medication, actually he is free of medication, the diabetic medication from first day, and by the 6th day he is able to overcome from the BP medicine also with a normal BP. With medicine his BP was high, but without medicine he was by the 6th day his BP normalized. And without medicine his BP, blood sugar normalized within the 2nd day itself actually. I am talking only about the HbA1c, which is we are checking inside the hospital. But he is actually daily checking it, the sugar. And by the 48 hours, 24 hours itself, his blood sugar is normal. But he is a very ideal patient also. It is all depends on the patient also, not for everyone. If the how the patient is following the things also is very important for this clinically supported lifestyle correction. Next is when you come to the blood report, HbA1c was with the medicine, HbA1c was 11.3. It was reduced to 6.6 in 3 months without medicine. That's why actually HbA1c is considered as a 3 months interval. It's an average of 3 to 4 months. So we usually when the patients are on a diabetologist will advise only once in 3 months. But for the clinically supported lifestyle correction, we check initially every week and then every month. So we want to finish it off everything. We should be free, and HbA1c also should be normalized within 3 months to maximum 4 months. If the patient is correctly following, by 4 months, the HbA1c also will come down below 6. In this patient, by 11.3 to 6.6 in 90 days. Okay, when the body parameters, the BP was 140, 100 with medicine, and 120, 80 by home monitoring within few days itself. Actually, by 6th day, it is medications, BP monitoring is, BP hypertension is over. When we come to weight reduction, he was starting 86 kg, 90 days, 69 kg. That means 17 kg reduction is there. Almost 20% reduction she achieved. That is actually distinction. This is actually this lifestyle, clinically supported lifestyle correction, we consider it's a course, not as a treatment. If the patient is come down to optimal levels, that is, he's 20% reduction. Obese patient comes to reducing 20% means he's getting distinction. Then when you come to abdominal circumference, the tummy midriff, 100 centimeters was the initially, and he came down to 86 in 90 days. When we consider the body age, actually when we start, 60 years is the original, its calendar age is 60, but his body age was 65. But at the end of 90 days, his body age is 50. His real age is, calendar age is 60 only. That means he was accelerated aging 5 years was there, but he was now reversed aging 15 years actually. And the 19 years he reversed his 15 years younger self. And the patient also feel it. Every patient who is undergoing this clinically supported lifestyle correction, they feel they young, and also they look younger also. Like look wise and feel wise, everything much younger. They won't feel their age actually. Next, what is the future? What is the idea? What is the advice for the future also? Or what is expected from the patient after this 90 days? Actually, after 90 days, we are, for the 180 days, there is a target also. For this patient, for the 180 days, we are aiming he will come down to 65 kg, and his BMI to be 21, because at this age, initially the reduction of the fat is actually easier, and maintain his BP at 120/80, and abdominal circumference he has come down to 86, but it will be ideal he can come down to 77 or around 75. And body age now also he's come down 50 only, but if he is able to follow the protocol for another 3 months and bring down his body age to 45, that is actually when we, if he, that is with this, when we put it in the, it's a, the system is analyzing this your body age, and it's a machine, that is a electrical impedance mechanism. That is, if you get produces 68, and if you are able to come down to 45, that is very good. Or when we put his instead of putting feeding the age is 60, if you feed us the age is 25, if he is able to keep show it, if the person is able to hit the reading as 25 itself, that means you are maintaining your body at the youngness of 25. If it is that is the, that you feel also you'll be younger with that body composition. In the future, we are correcting this, optimizing this body composition to balanced and optimal levels, and it is the patient's responsibility to maintain it. By 6 months, we will be able to correct it, and then it is for this much for this patient. If the patient is 100 kg, By 3 months or 6 months, it won't be possible. They may need, according to the excess body weight and the problems, they may need continuation, especially composition correction may need longer time. If a patient more than 100 kg, they may need 1 year, around 100 kg person or needed. It's all, again, it is depends on the patient's effort also. And then to maintain this omega-3/6 balance, to avoid high omega-3 inflammatory food and all. Is this person, this with the hypertension, dyslipidemia, diabetes and all, is always prone for heart, coronary artery disease, or peripheral vascular disease, all sort of vascular abnormalities, or heart attack, brain attack like a stroke and all. So they should always keep the inflammatory food, especially omega-6 food also, omega-3/6 balance to be maintained as 1:1. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Devara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments, along with the benefits and side effects, practical aspect of lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect your children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.